So you'll see we've also been joined by Vitaly from Ukraine and Nikolay from Russia. They are both presenting tomorrow, so they're not going to get a double chance to do quick overviews now. But I am going to take chair's prerogative. So if you do have a question, again, remember, I'm going to prioritize people who haven't yet had a chance to speak. So please do run over to the mic. But I'm going to ask Vitaly and Nikolay one question so we can get the discussion going. We've heard a lot so far about PrEP and men who have sex with men. What's going on in your nations and your regions to target PrEP access for women, for trans people, for sex workers, and people who aren't men who have sex with men? And Nikolay, okay?
Okay, so about what's going on with PrEP, now we start project for 100 persons. It's for MSM and transgender. It's like we have 55 persons now. They give analysis and debate results. Tomorrow I will tell we have some interesting stuff this start pilot project. In half year, numbers of users PrEP must grow to 3,500 persons. It must be in half year a national project. Now we are using a local project for Kiev. Yep.
Thank you. I would prefer to talk in a Madonna way, like micro, but thank you for that. So first of all, tomorrow I will show our ideas, our plans, because we don't have PrEP program, even pilot program in Russia, but we are planning to do it. And I will show our ideas and our allies who will help us to implement that method to Russia. So basically, as far as you know, that the main way of transmitting of HIV in Russia is among people who inject drugs. And I believe, like in my big dream, it would be great to use experience and knowledge of Bangkok Nafiri study to implement that method among that key population. But if you're talking about sex workers and women, who are also actually a vulnerable population. First of all, we'll start from MSM group in Moscow and Moscow region, and then we'll see how it goes, and we'll learn lessons, and then we will implement among other key population, of course.
So Thomas, do we have any Facebook questions coming through? No, nothing. No. Okay, so let's open it up to the floor. So. Hi.
Hi, Yavor from LGBT Действия, Bulgaria. So my question's about the statement from Slovenia and Croatia that both countries are low HIV prevalence countries. Bulgaria officially, on paper, also fits this description, but how confident are you that you are indeed a low prevalence HIV country? And I'm asking because we went to a study visit in Oslo, Norway last year, and Oslo is twice as small as Sofia city and has a dozen of centers for anonymous and free HIV testing. Sofia, twice as big as Oslo, has only 3. And I'm highly skeptical that the statement a certain country is a HIV low prevalence country is actually true. So how have you thought about this? Any strategies you're working on and stuff like that? Thank you.
In Croatia, there were several rounds of biological studies among MSM, and HIV prevalence was below 5%. And we think that may even overestimate because we were reaching those who were more likely to get tested. And among the general population, there are some indicators. There are no studies that would show us, but everything is showing in the direction that it's a very small number of people. And even with the recent mathematical modeling that takes into account the late diagnosis, it's still showing a small epidemic. But it's rapidly growing. So each year it's by 10% bigger. So it's going very, it's increasing rapidly.
It's the same in Slovenia, but each year we are doing some testing in MSM community, also with the drug users, with pregnant women, and until now we can still say that we are a low prevalence country, but every low prevalence, high prevalence country was once low prevalence, so who knows what will happen in the future.
And if I may comment on this one, I think the argument we need to use, and we are using it quite actually successfully in our case, is that yes, we are a low prevalence country, but if you look at the prevalence in MSM community in the capital city, it's 8%. It's certainly not low prevalence. It's reached the epidemics definition, so we actually have epidemics. And I think it's necessary to remind the public health authorities that this is the case. Yes, total number is low, but we have in one population we have a serious health crisis.
1 second, I think Michelle was before you. No? Okay.
Great. Michelle Ross, Clinic Q at London, Soho, 56 Dean Street. Just a couple of questions. I'm presenting tomorrow, so I'll keep them to these specific questions. Of the people, it's great to hear that some people, services are engaging with trans people. And what I'm wondering is how you engage with trans people in your services and how you capture the data of those people that are accessing PrEP and other services.
Okay, does anyone want to? How are you engaging with trans people? How are you capturing the data? Yeah.
I can share our experience. So basically, it was very new for Georgian HIV prevention programs to introduce the trans people because they always were under the umbrella of the MSM, as in many countries in our region. So it was the first time that in the HIV prevention program, the trans women in our case are the separate group. So majority of them, due to many reasons, including the social reasons, the stigma and discrimination, are involved in Georgia into the commercial sex work. So what we do is that we have the outreach workers from inside the community who help us to target, like to cover their peers in different places, mainly the streets where they work as the sex workers.
Hang on a second, Michelle. I'm going to give anyone else a chance to respond. Do anyone else? Hi.
Tomorrow I will explain our problem in our project and barriers, what we have. And we have some kind of stigma, and for transgender people, stigma is higher.
Yeah.
And also we have not enough of trainings for example, doctors and medical workers. So in our project, we had one transgender that was on a period of changing, and he said that he is still he. Firstly, want to be included in project. Then he consulted with his endocrinologist, and endocrinologist says that he will not recommend him to take PrEP. Then we consulted with our infectionist, and but endocrinologists say no, PrEP will be not good for you. So we lost this person who won't take PrEP.
Okay, thank you. That was really helpful. I'm going to present how we capture data tomorrow, and also I'm going to show how it doesn't affect anyone's issues for trans people, that PrEP doesn't affect. Okay?
Thank you, Michelle. So I'm going to take the next question there. Hi.
Hi, this is Ingo from Berlin, medical doctor, and I studied in Slovenia as well, and I know Slovenia, Croatia, and Czech Republic quite well. And I think the problem is now, it's a low prevalence country, but you should take into account that those guys are traveling a lot. They're taking EasyJet is now taking direct flights again to Ljubljana. They go to London. They go to Barcelona. They will leave the country, and if you don't provide them with PrEP before, they will infect themselves. And so, I mean, they are lost to follow up of this in this country because the infection counts in another country, but this doesn't mean that those guys are from your countries. And a lot of guys are in the closet still, and it's not open countries like UK or where you can go on the street and say I'm gay. You wouldn't do this in Sarajevo, for instance. So I think your countries need really big support from us.
Miran, do you want to respond?
Thank you, Ingo, to say that I can agree with you 100%. It's true.
So I also agree, but I think that the scale of how many people get infected abroad and in country it has changed, because we actually tracked that during the interview, and people are asked several questions to determine was it like locally acquired infection or outside. And in the past, almost all people in Croatia were getting infected abroad. But now, most of these epidemics are happening locally because it's still easier and you have more partners from Zagreb. And there was also a phylogenetic study that showed that they almost all belong to a same sexual network. So I agree, people travel and currently they're even moving out, but because this rapid growth, what's happening, and a lot of people newly infected, it has become really local epidemic.
1 second, Thomas. So before I open the floor to people who are chatty Cathys who've already said something, one last chance to get in line if you haven't yet said anything before I open it right up. Thomas.
It's not so much a question, it's two comments rather. One is to Michelle, and that what you said prompted me to say that in our countries, and I come from Hungary, it's the trans community is very invisible and highly stigmatized. And what I want to say that we should perhaps learn more about how their situation is. And there's very good research into that by a Hungarian sociologist and her team, Judith Takács, who has surveyed the situation of trans communities in Central Europe. And that explains why they are so invisible and why it's so difficult to reach out to them. And then to Ingo, and then let's discuss this then perhaps over dinner, how we can approach this. Yes, yeah. Yeah, okay. And then the other thing is to Ingo, actually, you guys also travel to Budapest and you travel to Belgrade because drugs are so cheap and sex is so easy to access. And Budapest is, for apparent reasons, the capital of gay porn in Europe. So it's not just that we go there and get ourselves infected in Barcelona or London, but also you guys come to Budapest to party, and so it's a two-way process, and EasyJet flies both ways. So we should really look at this. I mean, I think that this whole thing with traveling and moving, it's extremely important, but let's just not take it one way.
Okay. We could almost close on that comment, but we still have a tiny bit of time left. Are there any Facebook questions coming through? No? Okay. Let's see, is there anyone else who hasn't yet had a chance to talk, who wants to come and say something, ask a question, make a comment, make a statement? Greg, come on through. You've been very quiet so far today. Well done.
No, it's just for Croatia. I found you are on our analytics, and you, from the 1st of January 2016 until today, have had 340 people view our website. So not a lot of awareness there for us.
So Greg didn't introduce himself. That's Greg from I Want PrEP Now, as if he needed an introduction. So, yeah, come on through.
Thank you. As we move further east across Europe and we leave countries that are members of the European Union, how are your governments dealing with regulatory issues? Do they, as an individual country, want to approve the medicine for PrEP, or is there an overall way, like the European Medical Association, that can approve PrEP for the region that's further east, outside the European Union?
Thank you very much for your question. Well, unfortunately, we don't have any, in our guidelines, we don't have any information about PrEP at all, so probably we hope in the future it will be added there. And also in the instruction of Russian Truvada, there is no information that Truvada could be used as a PrEP. So the first step is to add in Russian instruction that Truvada could be used for PrEP. And as I have already told you that we don't have any approved generics in my country. So, but yeah, well, first of all, the first step is to add. If you are talking about help from healthcare ministry, but tomorrow I will explain and I will show you the way which we found how to do PrEP without help from the government. So it's also possible to do. And tomorrow I will show our thoughts.
So we have 3 people in line. If you really want to ask a question, get in line now because we've got 6 minutes left, and I am going to close us on time. And can you say who you are and where you're from?
I am Slavik. I am from Moldova, from Eastern Europe, and I want to answer to your question. For example, last November we developed a national clinical protocol on PrEP, what is an innovation for us. And we did it with the help of international consultants, experts, and we hope that until March the protocol will be approved by the Minister of Health and Social Affairs, and we'll start PrEP in Moldova.
Okay, so 1 second, I'm just going to go back to Giorgi.
Thank you. So very briefly to your question, I think it's really important and applicable to most countries in the Eastern European region, including Georgia, Ukraine, Moldova. The issue is that, for example, in Georgia now we do procure the medications through the Global Fund procurement mechanisms that doesn't require any inner regulations for the registration or import of the medication to the country. But as soon as the Global Fund procurement mechanism will not be applicable, and as soon as the medication will be procured through the state funding, and all of these countries are now the transitioning countries, this is will be the huge challenge to general access to the treatment in general, including using PrEP as the prevention.
So I'm going to take you, then I'm taking Mark, and then I'm going to take Sophie. Yeah? Okay.
I'm just going to pick up on where Tomasz left. I think the opportunity that we have representatives from WHO and UNAIDS, there's been mentioning of where people get infected, which country they go to. So does the WHO and UNAIDS have a framework or a committee or something working on an international policy which could solve the issues of regulatory issues between different countries? So if we're saying people are getting infected not in my country but in someone else's country, and the drugs are not being available in my country, can the WHO and the UNAIDS try to use this data and create a harmonized system where everyone has access to PrEP without blaming where the people are getting infected in country A or country B? Because treatment is not going to be available in every single country, but if we have international policy, we might get somewhere.
Rosalind and Yanis, we're going to come back to that if we have time. I'll hold on to that if there's time. Mark.
Mark Thompson, PrEPster. I'm presenting on migrant MSM tomorrow, and I'll warn you all now, I don't have the answers. But it's a question and a statement really for all of the guys up there from Eastern Europe and Central Europe. How can we work when we're running English language websites? We have lots of guys who migrate to the UK. What can we do to improve our work to make sure we're meeting their needs?
Okay, and I'm going to hold any of you answering back, but a couple of you, see if you can think, what can we do with UK websites to help the needs of migrants who are moving into places like London? Sophie.
Yeah, hi, I'm Sophie. I'm co-chair of the Sphere Forum, UK-based charity that focuses solely on women and girls and trans women as well. It's not so much a question, but I thank you for everything that you've shared. It's more to say that I'm seeing some females in the room, and any of you that are interested in speaking to us, we've produced some literature that is focused on women and PrEP and trans women. We've also developed a website which will put up earlier in his slide, and a bit similar to Mark's comment in that we're really keen to reach out to other European countries and have conversations about our literature being translated into other languages, and also for our website as well. Thank you.
Thank you, Sophie. So, Yanis or Rosalind, 30 seconds to respond to that if you want to. Yep. Go to the mic, please.
10 seconds lost.
15 lost.
Certainly we don't go for blame, but it is important to record where infections are, the best that you can to work on prevention. But I think this all feeds into what Winnie was talking about as well, that there is research that shows that new migrants, women, MSM, certainly I've seen those two populations researched, have an increased risk of getting infected when they newly arrived in their new country. So it's a population of high interest, nothing to do with blame, and the same guidelines would apply. But how we reach these populations is the question we're talking.
Okay, so final chance on the panel. Anyone want to respond to Mark's question about what we can do to support guys who are migrating into places like London? Zoran, I'm going to just put you right on the spot.
I was thinking, I'm still thinking, the first, I think it was comment more about translation to local languages. I think that could help. But I'm thinking of the people that I've seen to migrate, that they know English. So I don't know, is that helpful a lot? But what's happening when they are outside, they do connect with services. So they try to find help in language, but everything is different than the systems that they are used to. So it's some kind of a navigation and to show them what is friendly. So in that sense, probably translation would help, because then you have something in Croatian, so you're probably friendly toward people from Croatia. So, yeah.
Just a short answer. I would recommend you to do a partnership with the local initiatives in homeland countries. For example, we are AIDS Center Foundation, and we are the biggest media on HIV in Russia. So it would be useful for people who live in the UK to find a link in your website, or to find a link on our website, like to do informational partnership. I think it would be helpful for people who Russian speakers.
I clearly do not have the answer to this question, but I can share the Georgian challenge and experience we have. So the issue is that, for example, Georgian legislation doesn't allow to provide, for example, treatment or medication to not Georgian citizens. So what we are doing now, we are advocating for the to overreaching this barrier and providing them medications to the people who has the resident permit or has applied to receive the residence permit or something like that. I'm not sure if it's applicable for the Western European countries. So.
It's going to be 10 seconds, and then I really will. You're begging me, aren't you?
Just 15 seconds, because I'm from the region as well. And regarding the question, the lady she was here and the transgender people, and regarding the regulation pharmaceutical company, we don't have to forget that we have the custom union, which is joined by Russia, Kazakhstan, Kyrgyzstan, Armenia, and Belarus. They have their own regulation, and usually it's possible to influence in that system, but through the political situation or whatever is happening through the Russia, all other countries, neighbors, they are really affected from that. They can accept that kind of PrEP, but it's still, which is coming from the Russia, of course, it's not possible. Regarding the transgender people, what is happening now, the majority, the huge number of the transgender people, they are working in Russia as sex workers. And with the Russian regulation, of course, they don't have access for the treatment, and they're fully excluded, like a migrants community, transgender community, and MSM as well. I think we have to focus on that, because there is a lot of things now happening. We are just collecting the data through the FHI 360 and PSI, and the new assessments and the new data is coming out. I think that will be useful to use, kind of regulate the law or legislation that the people can get access to the treatment and testing.
Thank you so much. Give a big round of applause to this panel. And I'm really happy that we're now, all the issues around women and trans people and migrants are really coming to the fore of the summit. I think it's a really important thing that we focus on for the rest of the time we're together.